Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
We're the most famous physical therapist on the internet.
In our opinion, of course, Bob.
Today, we're going to talk about 7 pains you should never ignore. We all have a lot of pain in our life. Some of them might be our spouses, or we might be the pain. But there's certain pains that you don't want to ignore. These are the ones that if you have them, it's time to see the doctor.
Yeah, get them checked out and see what's going on.
Right. By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, go over to the Facebook. I don't know if I should announce this now, Brad, but we're going to be doing a giveaway.
Oh, okay.
We're going to be doing a giveaway a week for like 7 weeks.
Okay, wow.
Yeah, it's pretty exciting.
And
but
7's a good number.
Yeah, I figured you'd like that. Bob and Brad, and like us, and we'll give you positive vibes right now.
Right.
And you can become a good viber.
What are we giving away?
Well, that's
secret.
It's a secret.
Oh.
Every week it's going to be a new thing. And so we're building up suspense here, Brad.
There you
That's
go.
how a good channel works.
Exactly.
All right, let's talk about the first thing. Brad and I work with a lot of stroke patients in addition to other patients, or patients who've had brain tumors and aneurysms. And a lot of them that I don't know if you've run into this, Brad, but I've had a lot of them that said they'll describe it as the pain came on and it was like the worst headache in their life that they've ever had. I mean, if you get, if you never have headaches and you suddenly have a headache,
right,
that can be a concern. But 2, if you have a really bad headache, I would go in.
Sure.
Right. I mean, it's a sign something could be going on.
It's different than other headaches you've had. So, I have a friend, he has headaches all the time.
Right.
I mean, he's very aware of his symptoms. So, yeah, and don't get overly concerned about it. It's probably nothing, but get it checked out and, find out.
Yeah, because one thing that can mimic a really bad headache is a sinus headache.
Sure.
And you might have a cold.
Right.
But again, when you start getting a real sharp pain that you never had before, you want to go in. Because especially like with a stroke, the way they can reverse things now, you want to get in.
Right, there's that window of time where it's amazing how over the last 20 years, it seems like there's not been as many strokes or severe stroke cases that I've worked with. That's
the same with me, and when we do get them, they do so much better because they did receive that treatment.
Right,
they reversed the blood flow and all that. Okay, number 2, this is not going to be a surprise to anybody, but having pain in the chest, throat, jaw, shoulder, arm. It can even go down to the abdomen.
Right.
But we're talking about a heart attack possibly.
Right. Oftentimes it's elicited by activity. You start to do more activity than normal, and every time you increase your activity, you start to feel those pains. That's a strong indicator.
That's a really good point, Brad. Yes, like if you go and work in the garden and it comes on and you rest and it gets better.
Right.
That's a sign that it may be more of the heart.
Right.
A lot of times people talk about, sometimes they don't even have much pain, but they just have the pressure.
Right.
They feel like there's the elephant on the chest.
Right.
And you can often have nausea along with it. I'm not worried if you're an 18-year-old kid.
Sure.
That's a lot less likely to be the case.
Right.
But if you're getting up in our age, you worry about everything, man.
So yeah, it is that 50-year-old person, but even in your 40s. So if you're getting that chest pain, and I've went in twice so far for it. Both times they said you got better heart and condition than most people working here.
Sure.
So I'm not going in anymore for it. But,
right.
Actually, I think I've been self-diagnosed as Costochondritis, which we have some videos on that too. So it's a relatively high percentage of people with chest pain that go in and they come out and it's not a heart problem.
Yeah,
but at least
And I think with women where it can be a lot more subtle, they're the ones that really need to go in and get it checked out because they seem, it used to be, and I don't know if you think this is the case or how it used to be, Brad, is that it seemed like men had heart attacks and not women.
Right.
And they used to ignore it in women more often than men.
Right.
So, especially to you ladies out there, we want to make sure too, you're having any of those symptoms, you go in.
Right, get it checked out.
Next one, I kind of threw 2 in one section here, Brad. One is night pain. That's always a concern. I'm sure you have your doctor ask, does it hurt at night? Especially if it hurts at night and doesn't hurt any other time. It's just a concern.
Right. It's like no apparent reason, feel fine during the day, and then at night you get woken up by this severe back pain or hip pain, and it doesn't seem to make sense. What's irritating it when I'm sleeping?
Right.
get that checked out.
And the other one is what we call, and Brad, you and I had a discussion about this, and we maybe disagreed a little bit. I don't know.
Well, I just question it, just so it's not confusing.
Yeah, what we call central pain. So like, Brad, if you turn around once here, are we okay? I'm going to stand up here. So a lot of times when you have back pain, it's going to be either on one side or the other. It might be even on both sides. But when the pain is right in the center, or right in the center of the SI, then I just want you to be a little more concerned about it, because sometimes it can be pain in the bone itself, which could be cancer.
Sure.
I hate to throw that out there, but I had an employee that worked for us. She had pain right here, and she ended up, we found out later that she had Mets to the bone, metastatic cancer to the bone, and she died within 3 months.
Right.
So
I remember.
So it's just, I don't want you to cause any panic among you, but if it's right in the center, just little red flag.
Right.
That's all. All right, severe abdominal pain. You really worry about what are the common things that you might have. You could have an appendix rupture, which you obviously don't want to wait to find out how that turns out. I mean, you want to go in.
Right. And the appendix, my daughter had it, I had it. You got to go in. Now it's so easy. They make 3 little incisions, they go in.
Sure.
And you can be out the next day very easily.
Probably the same day.
Yeah.
Times, isn't it? I mean,
well, with my daughter, she went at 10 at night. They did the operation at 1 in the morning. She was out by 3 the next day.
Sure.
So, yeah, pretty within 24 hours or whatever. If it depends if you get the doctor at lunch or not. That
right. Gallbladder, pancreas problems, stomach ulcers, intestinal blockage. Generally when it is something going with the abdominal, I mean, it can be, something minor, like you just need to use the bathroom, but
right, or it just might be reflux.
Reflux.
Right.
But
I'm dealing with my mother right now. She's got gallstones, they found out, and they did a scope down her throat, and she has some inflammation in her, down by her stomach.
But you didn't ignore it. You took her in.
Right. So now we know she's got 2 problems.
Right.
So we know what to do now, or we're going to find out tomorrow, actually.
The next one is can be subtle on people, is calf pain. When you start getting pain in your calf, what we're looking for is that want to make sure it's not a blood clot,
sure,
deep vein thrombosis, because that blood clot can loosen up and go into your lungs, and it can actually kill you.
Right.
So a blood clot is not to be ignored, especially when it's in your calf. Often you have swelling along with it, redness.
Tender.
Tender. You squeeze it and it hurts like the dickens.
Right.
So, I mean, that's something you don't want to ignore.
If you're just did a hard workout, you haven't worked that muscle, and you just got muscle soreness, and it's on both legs, that's fine. This is something else where it's like, why is
quite often after surgery, or when you've been inactive.
Sure.
Or it can be when you fly.
Right, you've been sitting for a long period of time.
Sitting for a long period of time,
right.
Or let's say you've been in a car for a long period of time. I
sure.
mean, those are reasons possibly that could cause it.
And that's, again, we've got a good video on some tests for that, so that you can get more details.
Yep, very good. All right, number 6, if you have burning feet or legs, I read that 1/4 of Americans, of the 27 million Americans who have diabetes, don't know it.
Sure.
So that's a lot. I mean,
right.
So there's a lot of people that are getting this numbness and tingling and pins and needles and burning in their legs. What's going on here?
Right.
Well, you may be diabetic, and you need to get that addressed.
That's neuropathy. Typically have those symptoms, typically in both feet, below the knees.
It happens in the feet more than the hands,
sure.
But eventually it could be happening in the hands too. So.
It's a circulation issue.
Right. Yep. Exactly. The nerves have been affected, and they're not doing the job that they're supposed to be doing. Number 7, if you're getting vague and unexplained pain, like overall, it's just hard to even pinpoint where it's at. It's here, it's there, it's everywhere. This is really common with some psychiatric issues. I mean, you might have depression, especially if you couple it with, like, you have a loss of interest, or you're unable to work, concentrate. You want to have that checked out, because depression can be treated, and you don't want it to just go on and end up being manifested in other ways, and that affect your life negatively.
Right. We just did the video on the book about worry and how that
Right.
can affect your physical body, and the same thing with depression, or similar. I shouldn't say
Yeah.
the same,
Did that one
but
come out yet? No, that one didn't come out yet. Did it?
it'll be out within a week or so.
Yeah.
Yeah.
Oh, you can't wait now, I bet.
Yeah.
Well, by the time this is out, it'll already be out.
Right.
Yeah, so-
Sure.
okay. Well, that's the 7 symptoms or 7 pains you should never ignore. Make sure, if you haven't, like I said already, make sure you subscribe to us, because Brad and I are going to continue to give you helpful information.
You better believe it.
All right. Thanks for watching.